Just a simple program note. When you walked in, you should have seen note cards. If you have any questions for any of the panelists, please write your questions down so that we may have them answered during the town hall discussion portion of the evening. So without any more further ado, we have Ms. Yvonne Oliver. She's going to be discussing the Healthcare Act in detail in its entirety. Thank you.
Thank you, Representative Sykes, for inviting me tonight. And Amelia, my son and you are about the same age, and it's wonderful to be able to work with our youth. And I am delighted and grateful that each of you is here tonight, because I have some great news to share about the Affordable Care Act. And I love doing this because for the first time in 51 years, health care has made a turn. And it's a very badly needed turn. And so, Director Dawson, you couldn't have done a better job for setting the stage for our conversation this evening. How many people have ever been denied health insurance due to a pre-existing condition? Okay, how many people have stayed in a job that you absolutely didn't like, but it had insurance? How many people have worked multiple jobs and still didn't have insurance?
That's every job.
But some of those do. And how about knowing people that are in financial chaos because of medical expenses? So it's more than time. It is more than time for the Affordable Care Act. So you started off, and so did you, Amelia, with my favorite part of it, and that is the law is the Patient Protection Affordable Care Act. March 23rd, 2010, Congress signed into law the Patient Protection Affordable Care Act. And so it is important that you understand that it is protection for each of us. So when the Supreme Court ruled on it, they didn't rule on Obamacare. They ruled on the Patient Protection Affordable Care Act. 50 years from now, what's it going to be called? Patient Protection Affordable Care Act. Now, we're not doing remedial in here tonight, okay? So it is the Patient Protection Affordable Care Act, and I want to charge each of you with something. I love doing this, but Director Dawson and myself and Commissioner Nixon, we can't do this alone. So I'm going to ask you to talk to two people every day about this, because we don't want this to be an unnecessary election issue. We want people to understand the benefits of it. So here are the key blocks of the Affordable Care Act. One, it expands access to insurance. It increases consumer protections, and it's going to move us from a culture of sickness to one that emphasizes wellness and prevention. The other building block is that it improves quality and outcome of care, and it has already lowered health costs. So for the first time in the last 2 years, healthcare costs have gone down. So what's the good news? The good news is that people are no longer denied coverage due to pre-existing conditions. 2014, that applies to all of us. Right now, it currently applies to children, but there is pre-existing insurance. It ends annual and lifetime caps on insurance benefits. So that means you don't have to worry anymore that should a catastrophic illness occur in your family, that you have to worry that the insurance company is only going to pay $10,000. Gone. It closes the donut hole for Medicare. Right now we're at 50%. By 2020, seniors will no longer be paying anything towards their prescriptions. It also expands Medicaid, and I'm going to talk a lot about Medicaid because I know Director Dawson and I have been working a lot on that, and we're making recommendations to the legislature about how this Medicaid rollout needs to happen. It also allows for, and you heard the director here talk about, his daughter can now stay on his insurance to age 26. It eliminates co-pays and deductibles for some preventative care, or for most preventative care. Insurance companies can't drop you if you get sick. I think that's about it for some of the good news. So how is this going to happen? If you already have insurance with your employer, you get to keep it. If you don't have insurance, you will be able to go to a place, a marketplace, similar to Hotwire or Travelocity, called an insurance exchange. All adults with incomes up to 138% of the federal poverty line will be eligible for Medicaid. That's a wonderful thing because lots of adults who don't have children are now going to be eligible for insurance. Other people can also choose to have private insurance. And we'll talk a little bit about small businesses who will be able to purchase insurance through the exchange, and this is not going to put small businesses out of business. Almost everyone is covered, and that means how to cover almost everyone, and that is through the mandate. The mandate is not an enormous tax, but the mandate is necessary in order for everyone to pay their fair share. Now, you talked a little bit about emergency rooms. So I want to talk a little bit about emergency room care. Emergency room care is good for an emergency, but it is absolutely not the way to take care of yourself. So a personal example in my family is that my aunt is 78 years old. She has Alzheimer's. My cousin cares for her. She took her to the emergency room 35 times last year. You ask, why would anyone take a person to the emergency room 35 times? Anybody have any thoughts on that?
Because it's a government-controlled program that requires they go to an emergency room for standard health care because the government can't manage anything correctly.
Good answer, but not the reason why she's going. The reason why, did you have an answer?
Yeah, because they don't have a personal physician.
They have a primary care physician, but she doesn't trust the physician. She doesn't trust the physician. So when you begin to look at what is happening in Black and brown communities, there is enormous historical mistrust. And so my cousin walks into the doctor's office and she feels as though she's not being heard. She's not being listened to. Now, when she goes to the emergency room 35 times, how many people are listening to that? And so there is no coordination of care. And so you know that when you go to the emergency room physician does not call your primary care physician to coordinate, and then they decide that you need to go to rehab. The emergency room doctor does not call rehab and coordinate care, and many of us in this room have had that experience in caring for our parents or other people in our family, where you keep going to one doctor after the other and no coordination of care. So the beauty of this is that we will begin to have primary medical homes where people can find them. So getting back to this exchange, Congress, everyone has to buy their insurance the same way through the insurance exchanges. The insurance exchange is required to create what is known as a navigator program to, one, help people find out about new insurance options, to help people enroll in their insurance plan, and to help people stay in the coverage. How many of you all can pick out your own insurance plan? My employer said, I'm giving you health insurance, and I said, thank you. You don't know what you need until you know what you need. And so with so many people coming into the system who are without insurance, they are going to need a lot of help. And so that workforce component that she talked about creates these positions for navigators, and these must be trusted, or let's say they should be trusted members of the community who look like you, who understand what your issues are, and who can help you make the right choices along those lines. Now, it has to go one step further, and that is we need another position called a community health worker. Community health workers are those people, once you are enrolled, will help you get to the doctor. They will help you get the prescriptions. They will help you with the transportation. They will listen to you and help you work through many of those issues. Because again, having an insurance card doesn't necessarily mean that you're going to get good care. It just simply means that it just simply means that you have an insurance card. And to